Hello, everyone. Thank you for joining us. Our community public health expert is on her way. She should be here in a moment. And so I just wanted to let you know that we are here. We're going to just start in just a minute. You should know, and I'll say this again in just a moment, that your sound has been muted. So if you have questions or comments, please type them into the box. We'll be both monitoring them and moderating questions if there's time at the end. Again, I apologize that Dr. Baskin is running a couple minutes behind. I'm sure you can all understand with what she has going on that her schedule is not whatever she thought it was going to be even this morning. So we'll start in just a moment. All right. Dr. Baskin has joined us, so I will start over. Come on over here, Dr. Baskin. I'll start over for anyone who might have joined us. Wanted to just make people aware that your sound has been muted. If you have comments or questions, please type them into the comment box. We'll be monitoring that and moderating questions at the end as long as there is time. And I just wanted to just set the stage before introducing Dr. Baskin, who I'm just meeting in person for the first time. How are you? We find ourselves in the Jewish calendar between two holidays, Purim and Passover, which have as part of their makeup us gathering together communally. At a time like this, what does that mean for us in our community? How do we fulfill the obligation while also being prudent? Both these holidays also share something else, an enjoyment for us to take care of those less fortunate in our community at this time of celebration. This is obviously part of the constant Jewish reminder that even in times of plenty and joy, it's our responsibility to take care of those who have less. In Judaism, we have this notion that preserving or saving a Jewish life supersedes almost any other mitzvot in our tradition. And at this time of uncertainty and shifting realities on the ground, I'm suggesting that we hold on to those two pieces, the enjoyment to take care of those less fortunate, and that the preservation and protection of life is first and foremost. And it's in that light that we invited Dr. Carole Baskin, who's the Director of Communicable Disease Control Services for St. Louis County Department of Public Health. She's also faculty in biosecurity and disaster preparedness at St. Louis University College for Public Health and Social Justice, and has extensive training in emerging infectious diseases. As a public health expert, Dr. Baskin is here to help provide us with facts of the situation and best practices, point us to reliable and updated resources, and encourage us to consider steps our organizations might consider as this unfolding public health situation continues. So I'd like to welcome and introduce Dr. Carole Baskin.
Well, thank you very much for having me here. It's a privilege to be able to speak to this audience. So there we go. We start the presentation. Okay.
Yeah. Are we back? Okay.
Okay, so can everyone see the screen?
Yep.
Okay. All right, so what is COVID-19? COVID-19 is really the name of a new disease that is caused by a new type of coronavirus. The actual name of the virus is SARS-CoV-2, but it has nothing to do with the original virus that caused the SARS outbreaks back in 2003. We have many coronaviruses around us. Many of them are, do not cause severe diseases. Some coronaviruses causes just a common cold, but this particular coronavirus, is a bit different. This strain has been spreading since December 2019. And of course, as many of you know, it started spreading in Wuhan, China. It can be transmitted person to person by droplets from coughing and sneezing. So basically, you have to be fairly close to that person to be exposed. And what we call, excuse me, close personal contact, such as being 6 feet or less and touching, shaking hands, and things like that. Obviously, because it is transmitted through respiratory droplets, if you touch a surface that was contaminated with the virus in the past few hours, you may, get infected with it through that route as well. Also, in rare cases, it is contacted through the GI tract. Okay, so the symptoms appear in as few as 2 days or as long as 14 days after exposure to the virus, with a median of 5 days. And basically, they are flu-like symptoms, fever, cough, difficulty breathing. And the cases have ranged from a mild illness like a bad cold to severe pneumonia that requires hospitalization and in some cases, ventilation. There have been reported deaths. Worldwide, the mortality rate is around 3.4%. And deaths have been mainly in older adults and those with other health conditions like heart disease or diabetes. So right now we consider that the most vulnerable population is the elderly. Again, it is not the same virus that is the one that caused SARS and MERS, although it is in the same family of viruses, but it is not the same virus. It is not a strain of influenza. It has absolutely nothing to do with the flu, and it is not man-made. So early on, many of the patients in the outbreak were in Wuhan, China, and more widely in that province around Wuhan. And it is believed that maybe the initial transmission was from animals to humans, because the initial cases were traced to live market, but really at this point we do not know this for certainty. Right, so we still know very little about this particular virus, so a lot of the assumptions that we are making are based on similar coronaviruses. Again, it is thought to spread mainly from person to person between close contacts to respiratory droplets. It is not believed to be spread via aerosols, and by aerosols I mean long distance traveling smaller droplets. So, we don't think that, it can be transmitted through HVAC systems or anything like that. And again, if you touch an object that was contaminated with the virus, it is possible that you can get it that way. Similar coronaviruses do not live on surfaces for more than a few hours to about 24 hours. So fortunately, it is not a very hardy virus. However, it is still very important to keep surfaces as clean as possible. Now, in terms of some viruses, for example, the flu, will be people who have the infection are able, in some cases, to transmit the infection before they themselves show symptoms. But in this particular case, we do not believe that this is what's happening with this coronavirus. Even if people can perhaps shed the virus to a small extent before they become symptomatic, we do not believe at this point in time that it is enough to cause productive infection in someone else. So therefore, when we start investigating cases, we start contact tracing when somebody becomes symptomatic. Right now in St. Louis, we do not have community spread. We have had one case, but that was travel related, okay? So in a way, this is really an opportunity for the community to really prepare, okay? Because we probably will have, some amount of community transmission, but again, this is not true today. Prevention, we do not have a vaccine for coronavirus, for this coronavirus, or any other actually, and we do not have antivirals available. So the best we can do is prevent infection, and once somebody has the infection, is to provide supportive care. So a very important way you can protect yourself is through social distancing. You know, if people are sick and you're not sure why they're sick, they have respiratory symptoms, just stay away. Avoid touching your face, you know, because all these viruses, you know, they infect people through mucous membranes. So you really want to try to, you know, avoid, self-contaminating that way. If you are sick, you really should stay home, and that's also true for influenza. If good respiratory etiquette, if you cough or you sneeze, just, you know, cough in your sleeve, and you know, don't cough in your hands and then touch things. Cleanliness, wiping surfaces. There are many products that are effective against this type of viruses. You know, for those who are familiar with viruses, coronaviruses are envelope viruses. So they are very sensitive to alcohol-based products. As long as there's at least 60% alcohol in the product, they are sensitive to products that have bleach in it, 10% bleach. So fortunately, it's not a hard virus to kill. Wash your hands often, you know, and do it well. And alcohol, you know, hand sanitizers, you know, are effective if you don't have a way to wash your hands, but it's still better to wash your hands. Treatment, again, there's no specific antiviral treatment recommended right now. People get supportive care, the same care you would get, you know, for, you know, regular flu. If you think that you may have been exposed to COVID-19, you should contact your healthcare provider immediately, but do not just go to the emergency room because then you might infect other people, and they probably are not the best place to help you in, you know, right away anyway. So, okay, what is our role at the health department? What we do is, you know, we monitor the situation. You know, when somebody comes back from one of the countries which are considered high risk and they have symptoms, you know, we start monitoring them, and we get them tested if they have symptoms. And, you know, we do contact tracing, and we, you know, right now we're still working out the different types of self-quarantine that people have to do. And, but we're coming up with a policy today. Person under investigations are people who are symptomatic and have other risk factors, such as, you know, coming back from certain countries. These people definitely have to self-quarantine, and we are working out ways that the hospital systems in the region can set up alternate locations to receive patients who may have COVID-19 so they can be tested. We also coordinate with the state and with the federal government. Right now, we have fully activated our emergency operations center. There are people there 24 hours a day who monitor the situation and partner with, you know, the police and, you know, EMTs and people like that. We have a pandemic plan in place. We had a plan before, but I updated it last weekend, and now we are definitely ready to go. There's a lot of real-time efforts going on right now at the health department. We have several hotlines that are, you know, in place, and I can forward that information later because we have new hotlines as of yesterday. The state stepped in, and the United Way stepped in to answer level 1 calls. And calls that have to be elevated, you know, are elevated to public health nurses and people like that. We have a team at the public health department. We have a team who specialize in community education, and they are the ones who generally will come to give presentations, because my staff is actually busy, like doing surveillance and things like that. So we have engaged them so that they can provide basic information to various stakeholders, and we're very grateful for their efforts. They're also working very hard. So clinical staff, it really doesn't apply to this audience, so I think I may skip these particular slides. again, prevention starts with individuals, with decisions that you're making to stay home if you're sick. Right now, because we don't have community-based transmission, even though a lot of entities are deciding to cancel mass gatherings, this is not coming from the health department necessarily. We think it's a good idea, but right now there is no mandate to do that until we start having community transmission. This is one of the hotlines, and I will forward the number for the other one later, so you can distribute that. Also, one thing I want to mention is there are a lot of rumors going around and a lot of things on social media. But if you're looking for information that is reliable, you should go to reliable sources. You can go to our website, but because it's a fast evolving situation, the CDC is still the primary source. They have a very good website right now on COVID-19. It's a little bit complex to navigate because they have so much information for various entities, but it's still the best and most reliable resource. The state of Missouri also has their own website, and you can go there as well.
Thank you, Dr. Baskin. So I just want to reiterate that we will not only get you guys the information that you need, the hotline numbers, but on the Federation webpage, we have a resource page, which, as Dr. Baskin said, really relies on the primary sources of information, the WHO and the CDC. As you heard her say, and I'm sure you're all aware, there is a lot going on in social media. Part of our job as leadership is to help lead and to make sure that the right information is getting out and that we're helping to combat some of that false information that is out there. So go to a trusted source. We will link to CDC and WHO. You can certainly go to them directly, and we will make sure to get you the appropriate hotline and phone numbers so that you have them and can share them with your staff and support. Are there any questions or comments from the group? If you do have a question or anything, please type it into the comment box. I see one is that when will the PowerPoint be made available? I think we will put it up as soon as we're done here. Yeah, any other questions? Oh, we have some.
Okay, supportive care.
Supportive care.
Okay, so basically, it would be the same as for, like, if you have the flu, take non-steroidal anti-inflammatories like ibuprofen, Tylenol, drink a lot of fluids, get a lot of rest, and try to isolate yourself from the rest of your family. You can where if you are ill, there's suggestions to wear like a surgical mask if you absolutely have to go out of your house while you're ill, because this protects other people from your respiratory secretions.
I saw a question on here. We are recording this and we'll be posting it and sharing it. And once we share it with you, you're welcome to share it with whomever you'd like. There's also a question I see at the bottom, I think, around recommendations for schools. And I believe that there are a couple of sessions set up.
Right. So we had one session yesterday with several school districts, and headmasters of private schools were there as well. We will have another one next Wednesday at 10 a.m. and it's at the Public Health Department in Berkeley. And I believe the individuals here will have that information. For schools, right now, there are many schools who are very concerned, and obviously many parents are very concerned. But again, we don't have, community transmission right now. If there is a child who is themselves affected with the disease, meaning, they are ill and they test positive for the disease, we will notify the school, the leadership of the school. Usually we go through school nurses for that. And then the school has to make a decision, and we are happy to provide guidance and all that. But at this point in time, we are not mandating any schools to close, okay? if things really go much further than they are today, yes, we do have that kind of power at the county to close things down, but obviously this is not the case right now. So, you know, it's really the decision a decision that a school has to make, whether to close a classroom, because we're talking about close contact transmission. So if you have a sick child, it probably would not be a matter of closing an entire school, but it would be a matter of maybe closing the classroom, while the disease takes its course.
So I saw another question. Somebody asked about schools, but there's another question about the Federation and what it's doing. And so I will share what our plan of action is and the steps that we've decided to take. We're approaching this from the position that we want to protect our staff, our volunteers in the community as much as possible, and that we don't have a critical public service like a school or something else. And so we've decided that our organization is going to remain open during normal business hours the way that we have been, with a few adjustments. First of all, any travel that staff was planning on doing for work purposes, we've canceled. We've also decided that any meetings over a few people will be done either through electronic or telephonic means. And this is just a precautionary measure in order for us to be able to say that we are both providing an opportunity for people who might not feel comfortable going out to be able to continue to participate in the business of the community that's happening, but also just reducing the number of touch points that happen. So in addition to those meetings happening electronically, we've decided that for at least the next several weeks, we're canceling any events that we as an organization were putting on. And that's something that we are going to continue to evaluate on a weekly or bi-weekly basis, so that right now we're saying through March 31st, but next week we could extend that based on what's going on in the community around us. Something that you should be aware of is we've also made the decision that we've decided to cancel some events. Not every organization has. The Federation will continue to support organizations in their events, but we will not be permitting staff to participate in other community gatherings as a staff representative of the Federation. So we'll continue to support you in the ways that we've indicated we have through monetary support and other things, but our staff won't be participating. The one exception to that is that the security apparatus through Scott Biondo and his staff will continue to work with you and provide safety and security for any events that are going on until or unless such time that it becomes a health risk for our security experts. So, yeah.
Yes. So there are a few more things I'd like to mention.
Please.
So this is really the time to think in terms of, what if there is, a community transmission? What if my school or a classroom has to close? For businesses, this is really the time to think through, what are my essential services? How much of my staff can telecommute, and still contribute? For schools, what is your plan for, distance education? Obviously this is kind of short notice, and many of you, probably will feel that they're taken by surprise by this. But this is, it doesn't have to be perfect, but it's good to have a plan. I see some questions about services. So at this time, I would say that people who are vulnerable physically, should probably think about avoiding services. Elderly people and, so, that probably would be a good idea. Right now, there is no mandate because we don't have a community transmission, but, we may have it soon. And at that point, yes, you should think about, doing services remotely or, through some other means.
And so I think one of the things that we wanted to make sure is that this is an opportunity for community leadership to ask the questions so that they can prepare. And one of the questions is, what would a possible situation look like that would begin a mandate to stay out of public public areas or large gatherings? Is it when that transmission happens within the community that kind of the switch flips?
Yes. So, actually, St. Louis has a very good history with, for example, back in during the 1918 flu, they actually took a leadership role in just preventing a lot of community spread. And I can see, from the people I've talked to so far in the community has been very aggressive about already canceling a lot of events, just to be safe. SLU is extending their spring break. I think that WashU is doing the same. I spoke to other religious leaders, and they are taking, pretty aggressive measures already. So I think if we are in a situation where we have widespread community transmission, at this point, yes, we will ask, large events to be canceled. And, we're still working through, the authority lines to actually have a legal mandate to do some of those things. But this should all be clarified within the next couple of days. We are working with the county counselor's office right now to iron out, some of those authority lines, and, including for quarantine.
So there was another question in here around food, and if there are precautions or restrictions around food and food servicing, because we do that a lot, obviously, at shul, right, with
Yes,
lunches and
of
other
course.
things like that.
Yes,
Any
well,
precautions?
yeah. Well, fortunately, food services already have a lot of precautions to avoid the transmission of communicable diseases. So I think at this time, this probably would not be a primary source of transmission. Obviously, if somebody is ill, they should be excused from food service. And this is really, I know this is a tough profession to be in because, people tend not to have as many benefits, and they really need to be there, to get paid. So I think, if there are any employers out there, who face those dilemmas, this probably would be a good time to be generous with your leave policies and to sort of, make sure you make humane decisions, with the people's well-being in mind, as well as public welfare.
I will say that, for example, the Federation, we have extended our ability to do these kinds of video conferences, gotten additional licenses, are working with staff to understand how to use them and do them so that if they either have someone in their own home who either contracts a disease or is a vulnerable population that they need to take care of, that they can work remotely. And we're actually set up at this point to allow our entire staff to work remotely should that become a necessity. But again, this is in order to allow people to be able to make the decision for themselves. While we may be open as an institution, there may be people who have individual cases and situations, yes, and we want to allow them the flexibility and compassion to be able to both continue to do their work and do it in an environment in which they feel safe.
And, if we have situations where schools, daycare, closed, obviously, these children would need, to have a parent present, and, many people can still work from home with their children there. So, I mean, these are all the kind of things you need to think about.
There was a question about evaluating staff who's traveling domestically. And the only thing I can share is what I've heard and what we've decided here. We've put together a policy that basically says, if you go to a level 3 country, countries where the disease really broke out, then you need to follow the CDC mandates on time away and testing. If you've gone to a level 1 or 2 country, which is really only Hong Kong and Japan at this point, then there's a mandatory 14-day period before you can return to work here. We haven't gone as far as to address either domestic or other international travel, and we're kind of going to take it as it comes, because I think a lot of individuals will decide on their own whether or not they're actually comfortable traveling or not. And as this continues to change and expand, that may change day by day.
Right. So I'm glad you talked about quarantine because we are ironing out those policies right now. And so right now, we are only notified as a health department if people are coming back from China or from Iran. That means that even if people are coming back from other level 3 countries, we are not directly notified. So we really rely on the community leaders, and employers, to institute policies, that encourage and do not penalize people for undergoing their voluntary and highly recommended quarantine if they come back from level 3 countries, or if they come back from areas of this country where there is sustained community transmission. And that's all, the self-quarantine part in terms of being voluntary is of course only in asymptomatic people. Once somebody is symptomatic and they come back even from those areas of this country where there is sustained community transmission, they become person under investigation and they become tested. And at this point, the quarantine is mandatory.
Are there other questions? What a great example.
He coughed in his sleeve, right?
So I do want to say that obviously as this situation continues to change, we have a responsibility to think about and take care of our entire community and those that are most vulnerable. And there will need to be opportunities for all of us to come together, to collaborate and cooperate in order to make sure that particularly seniors and people who are homebound due to illness are able to function and not just get medications and get food, but also the social isolationism isolation that happens. We're talking about social distancing, but there's a difference between that and social isolation. And we need to all work together to make sure that we're reaching out to and engaging members of our community. This may be an opportunity for us all to find different ways to go about doing our work and engaging with the members of our own community. We as a federation will continue to put up information as we have it and share it with you. If people have specific questions for us, please feel free to reach out to whatever Federation staff person you're familiar with and connect with. I think Dr. Baskin probably isn't going to be giving out her cell phone number. She has a lot going on, but we will continue to liaise with her and her office to make sure that we get the most recent and information out as we can. I don't know if there are any other questions or closing thoughts that you have. We don't need to stay for a full hour if people don't have any other questions about things.
Right. I mean, fortunately, I guess in closing, I want to say that now we definitely have the data that social distancing does work to curb transmission within a community. And that's, we have all these data thanks to the 2009 pandemic. So these measures, whatever we recommend, they are evidence-based at this point. It does work, and we just have to be willing to implement it. And fortunately, nowadays, it's not like before, people communicate electronically, a lot of delivery services are available. So while it will be hard, for some people, it's not as hard as it was, it would have been like 30 years ago. So
we will make sure to get you a copy of this with a link to this video and the link to the resources that are available with the phone numbers and everything else. I want to thank everyone for participating. This is obviously a situation that's very fluid and changing, and we'll continue to be in touch with everyone. If you have broader communal concerns or things that you think the community needs to be focusing on that it may not be thinking about, please don't hesitate to reach out as we work through this together. Thank you all very much for your time today, and Shabbat Shalom.
Shabbat Shalom.